You're opening a letter, your finger slips, and ouch, a tiny paper cut. Within seconds, a small drop of blood appears on the surface of your skin. That tiny slip of paper just kicked off a massive emergency response beneath your skin. It is the start of a complex, microscopic construction project where millions of specialized workers rush in to repair the damage. This diagram maps out the exact timeline of that rescue mission. Looking at the left column, you can see the process is divided into 4 distinct phases: hemostasis, inflammation, proliferation, and finally, maturation. This healing process is a highly choreographed sequence. Your body actively works to prevent infection and restore function through every stage of the repair. The first phase is hemostasis. Your body's immediate priority is to act like a team of emergency plumbers. Tiny cell fragments called platelets rush to the torn blood vessel and stick together to plug the leak and keep your fluids inside. Those clumping platelets activate a biological trigger that builds a physical barrier over the injury. Here is a microscopic view, a dense web of white fibers that physically traps red blood cells to form a stable clot. This web stops bleeding and creates a temporary floor for future cells to continue repairs. Achieving this rapid plumbing repair is a critical first step. It preserves the high pressure of your circulatory system and makes every other part of the construction project possible. With the leak plugged, the project moves to phase 2, inflammation. Now the body deploys specialized cellular security forces and hazmat teams to fight off any invading germs. The first responders are neutrophils. These fast-moving white blood cells act as a frontline defense, hunting down and destroying invading bacteria. Right behind them come the macrophages. These are the heavy-duty site managers. They systematically sweep through the area, absorbing dead tissue and clearing away debris to prepare the site for rebuilding. As they clean, these macrophages release chemical signals. These signals act as a command for the body to start the actual rebuilding process. To make room for the new crew, the body uses a process called fibrinolysis to dissolve the initial emergency web. Clearing this temporary patch allows new cells to migrate freely into the wound space. While we often notice the redness and swelling of inflammation, this stage is actually a vital site clearance operation. It is the necessary work that must happen before new construction can safely begin. Now that the site is secure, phase 3 begins, proliferation. New cells move into the gap to deposit a permanent structural foundation. A busy construction zone needs a steady supply line. Your body sprouts entirely new microscopic blood vessels that extend into the empty space, delivering the oxygen and nutrients needed for growth. As new tissue fills in, specialized cells grab the edges of the wound and physically pull them together. This mechanical contraction steadily closes the gap on the surface of your skin. By the end of this stage, the temporary patch has become a closed, fully supplied living barrier. The emergency phase of the injury has officially ended. Even when the scab falls off and your skin looks smooth, the project is far from over. The final stage is maturation and remodeling. This is where the body slowly swaps out the hasty, temporary building materials for organized, permanent scar tissue. This strengthening process takes a surprisingly long time. Your body will continue remodeling that small patch of tissue for up to 18 months after the injury. This chart shows how these 4 phases overlap. The security team arrives while the plumbers are still finishing their work, and the decorators continue their refining long after the builders leave. Every healed wound is a testament to this success. That faded scratch represents millions of microscopic specialists executing a perfect, functional factory reset of your body.